Welcome to our channel. Today we're delving into an important health topic, the connection between diabetes and skin conditions. Diabetes, a condition that affects millions worldwide, doesn't just impact blood sugar levels. It can also lead to various skin issues. Knowing these conditions can help in early diagnosis and management. Let's explore 12 skin conditions associated with diabetes. First, let's talk about diabetic dermopathy. Often referred to as shin spots, this condition manifests as light brown, scaly patches on the skin. They are usually harmless and appear on the fronts of the legs. The spots are the result of changes in small blood vessels and are quite common in those with diabetes. Next is necrobiosis lipoidica diabeticorum, a condition that also affects the legs. It starts as small, raised areas that progressively turn into shiny scars, with a violet border. Though it can be itchy and painful, this condition is relatively rare. It is more common in adult women and can sometimes precede the diagnosis of diabetes. Another significant condition is diabetic blisters, known medically as bullosis diabeticorum. These blisters can appear suddenly on the skin of the fingers, hands, toes, feet, and occasionally legs or forearms. Fortunately, they are painless and tend to heal without leaving scars, but their sudden appearance can be alarming. Let's move to fungal infections, which are more prevalent among diabetics due to weakened immune responses. Candida albicans, a yeast-like fungus, is a common culprit, leading to itchy red rashes surrounded by tiny blisters and scales. These rashes can appear in any moist fold of the skin, such as between fingers or under breasts. Then there's acanthosis nigricans, characterized by dark, velvety patches typically found in body folds such as the neck, armpits, and groin. This condition is not exclusive to diabetes, but is also associated with insulin resistance, making it a key indicator for many individuals. Granuloma annular follows, which appears as raised, ring-like or arc-shaped rash, most often found on the fingers or ears. While this condition can occur in anyone, disseminated granuloma annulare might signal diabetes in some individuals, particularly when the rash is extensive. A particular concern for diabetics is digital sclerosis. This condition leads to thick, waxy skin developing on the backs of the hands and sometimes extending to fingers, creating a stiff feeling. The condition's severity often correlates with the level of glucose control. Not forgetting, there's eruptive xanthomatosis, marked by firm, yellow, pea-like skin bumps. Each bump has a red halo and is itchy. This condition generally occurs when diabetes is poorly controlled and triglyceride levels are significantly elevated. Vitiligo is another condition that might not immediately come to mind when discussing diabetes. This autoimmune disorder causes the loss of skin pigment, resulting in white patches. It occurs more frequently in people with type 1 diabetes, wherein the immune system attacks the pigment cells. Moving on, skin tags are small, soft skin growths commonly found in those with diabetes or metabolic syndrome. While they're generally harmless, their presence could indicate an ongoing issue with blood sugar control. Another complication to be aware of is psoriasis. While not caused by diabetes, there's evidence to suggest a higher prevalence among those with the condition. Psoriasis is marked by red, inflamed patches covered with thick, silvery scales and can be itchy and painful. Finally, we address scleroderma diabeticorum, a condition somewhat similar to digital sclerosis but involving thickening of the skin on the back of the neck and upper back. It's a rare complication that usually occurs in individuals with type 2 diabetes and requires specialized treatment. In conclusion, diabetes is a multifaceted disease that goes beyond affecting glucose levels. It intricately affects the skin in numerous ways. By recognizing these skin conditions, individuals can seek timely medical advice, leading to better management of both their skin health and their diabetes. Thank you for watching. If you found this information useful, please consider subscribing for more insightful health content. Remember, being informed is the first step toward prevention and effective management. Stay healthy and see you next time.